much. Anna's going to stay on the main stage. We have the pleasure of engaging in a Disparities deep dive conversation on American Indian and Alaskan Native community and what we can do to support the community. Dr. Janelle Palacios is a nurse midwife, researcher, and storyteller, originally from the Flathead Indian Reservation in Montana, and she'll be serving as our moderator today. She's the founder of Encoded for Story, a story-based consulting firm helping individuals and organizations link the importance of history and story to address and improve maternal child health outcomes grounded in family and community partnership. Her experience in maternal health has been nationally recognized, most recently with the completion of a national appointment as a committee member on the Advisory Committee on Infant and Maternal Mortality under the Health Resources and Services Administration, HRSA, who we'll hear from today as well. Through this appointment, she co-chaired the Health Equity Work Group and was a key author on the committee's recent report titled Making Amends, Recommended Strategies and Actions to Improve the Health and Safety of American Indian and Alaskan Native Mothers and Infants. And we're so grateful for that work and can't wait to learn more about it today. Also having a conversation with us this morning is Mary Banahan, a nurse practitioner with 20 plus years as a volunteer at the Postpartum Resource Center of New York, which we heard Anna talk about. She's had the opportunity to develop programs that support communities across the state of New York through the organization's Project 62 program, which aims to build perinatal mental health wellness and parent support networks in all 62 New York counties. She has served as a speaker in various settings, including being featured on the Today Show. I had to say that, Mary, that's pretty amazing. And also our final guest on the panel is Sarah Kerrigan. Sarah is a health communication specialist at the Division of Reproductive Health within the CDC. She currently serves as the Hear Her campaign lead, overseeing strategy and implementation of the multi-segment campaign that works towards improving maternal health outcomes by raising awareness of the urgent maternal warning signs and improving communication between healthcare providers and patients. She was instrumental in developing the CDC's recent American Indian, Alaskan Native, AIAN, Hear Her campaign materials. We are so honored and thrilled to have all of you on the main stage. With that, I'll turn it over to all of you.
Thank you. Thank you, Anna Red Fox, for your bravery and sharing your story. Before I begin, I'd like to share with you all where I am. We often forget in this country that the original people, the first people in these lands, were forcibly displaced by state and federal policies. Currently, I'm in Bozeman, Montana, ancestral lands to the Appaloosa, Salish and Nahutne, Blackfeet, Cayuse, Umatilla, Walla Walla, and Cheyenne peoples. I invite you all to check whose ancestral lands your feet are resting upon now by following the link in the chat I just posted. I would like to then invite Mary to introduce herself.
Hi, good morning, good afternoon, everyone. My name is Mary Banahan. I'm actually a physician assistant. Shout out to my NP colleagues, who I'm a PA and assistant professor at the Hofstra University PA program here on Long Island. I'm also a long-term volunteer for the Postpartum Resource Center of New York here on Long Island, and our advocacy team leader. Just quickly, I started with the Resource Center after my own lived experience with postpartum depression, OCD, and anxiety after the birth of my second son 22 years ago.
Thank you, Mary. Sarah, please introduce yourself.
Hi, I'm Sarah Kerrigan. I appreciate Joy's introduction. Before I go further, I'd like to acknowledge and honor the Creek and Cherokee nations and their people on whose ancestral homelands I'm speaking from today. I also want to thank Anna. Thank you for sharing your story. I'm still, catching my emotions from you sharing, and just for all of the work you do so that others don't have the same experience. I'm honored to be at the table with all of you today. Thank you.
Thank you. So I want to take a step back for just a moment. You're all likely aware everyone who's invited attending, that despite being a developed country, we are dead last in our maternal and infant outcomes amongst developed nations. And we have a good reason. It is because of our nation's history and how Black and Indigenous women and women in general are treated in our country. And for those reasons, we are dead last. Women do not matter in some circles, and bodies are objects to be acted upon rather than to be acted in partnership with. And there is a change that's happening. It's slow to happen, but all of you who are here present today are now blessed with this knowledge and information. And now you are invited to carry on this work in all the realms that you touch. All right. So I just want to thank you for being here, and then invite you to take in all this information that will be shared and really challenge you to how you will be using it in your own practices and your own spheres. I would like to turn to Anna and ask a little bit more, Anna, about, I'm looking at the chat and I can see very clearly that the healing part of your experience is really reaching out to a number of people. And I would just like to ask, can you explain a little bit about how there has been a disconnection that you have experienced and seen, and how there has been a reclaiming of a birth experience, and how that affected you, what you did to do that, and what you hope to do for the future?
Thank you for that question. I think the biggest disconnect comes from community. Community is birth and birth is community. And I think that in today's society, we have really lost sight of community being in birth and everyone having a part in community. It doesn't just mean throughout pregnancy or the labor in your birth support team. It goes beyond labor and birth. It goes throughout postpartum and especially parenthood. And if you look back on our ancestral teachings of Indigenous people and other communities around the world, community is such a huge part of their birth. The men have a place, the women have a place, the grandmothers and aunties were the original doulas and the midwives. And I think that was a very big disconnect that I learned when I experienced my first birth. And that fueled my motivation to bring that sense of community back and just to reclaim our birth teachings, because we are one of the first contact tribes being on the East Coast, and we have lost a lot of our birth teachings, not just our language and our culture and our traditions. We have lost our birth teachings as well. And like I mentioned in my story, we are referred outside of the community. So a part of my mission and what I see for the future is returning birth back to the community entirely, and having a birth center and lactation consultants and midwives and doulas that are very prevalent and immersed in our community.
Mm-hmm. Thank you for that, Anna. Anna is alluding to something that is not really known in our nation's history, and it wasn't certainly taught in middle school or high school, that there are federal and state policies that systematically disempowered Indigenous people and actually outlawed traditional practices. So can you believe it? How many of you were born before 1978 and born after 1978? And 1978 is very important in Indigenous history because that is when the United States allowed Native people to resume practicing their cultural and religious beliefs. 1978, not long ago, within living memory. And it is specifically for these reasons of outlawing cultural practices and beliefs that, if you can imagine having intergenerational experiences of having your language taken from you, being forced to only speak English, having your children put into boarding schools forcibly from age 4 until age 18 or 19, not allowed to come back and see you. Can you imagine being displaced from your ancestral lands and put into really small, tiny reservations or smaller lands and not allowed to leave? So starving, not having access to traditional foods, and being so disempowered that you are dependent upon the federal government for subsisting, for living. That is what has happened over our nation's history. And it has culminated in intergenerational effects that arrive today in mental health issues and concerns, and intergenerational abuse. And we have people who try to self-medicate. So in our communities, we have a high rate of substance use and mental health issues. And we can understand that these high rates exist and these experiences exist because of intergenerational effects that have happened over time that continue today. So Anna, thank you for sharing that. There has been a loss of cultural connection, and it was intentionally done so. That is very important for people to understand. And that the very fact that you sought out healing, and part of that big part of healing was bringing community back into your birth experience. That is something that is not done in a Western world. Community has no place in healing. And that could be something that possibly could enrich our people's outcomes, our women's outcomes, our infant outcomes. Thank you. I'd like to ask Mary, what brought you to Shinnecock Nation? I understand you came from the Postpartum Resource Center and you had resources, but what brought you to Shinnecock Nation with these resources? And what was the master plan in coming to that nation?
So I had wanted to work with Indigenous women for a while. I felt that even amongst marginalized populations, that Indigenous moms were often left out of the conversation. To start with, Shinnecock was a no-brainer. They are part of our Long Island community. They are our neighbors on Long Island. I happened to be on a 2020 Mom webinar with statistics citing how the risk of maternal suicide was so much higher in Indigenous moms, specifically Native American and Native Alaskan moms. And that was really the impetus for me. I felt that I had to do something, and we wanted to start with the Shinnecock Nation. So with a colleague of mine, PA colleague from Hofstra, and Sonia Murdoch from the Resource Center, we applied and obtained a grant through the NCC PA Health Foundation in order to train the trainer. We felt that it was of the utmost importance to empower the healthcare providers from Shinnecock to help their own moms. We felt that the stigma for all moms is so great, but especially for Native American and Indigenous moms. And we wanted to empower their community to help their moms, their healthcare providers specifically. We didn't want to come in as the saviors. We wanted to train the trainer. So that's what we did. We had several sessions, as Anna mentioned. We educated them about maternal mental health disorders. And this was tribal leaders and healthcare providers from Shinnecock. It was a wonderful experience. Subsequent sessions taught them how to use screening tools provided, how to screen their moms, how to do telephone support and support groups within their own community. We established a palm card, an informational palm card that had a Shinnecock mom and her child dressed in Native, beautiful informational palm card, dressed in their Native attire. And some of the language on the informational palm card was also in the Shinnecock Native language. We felt that it was very important that we empower them to help take care of their moms. We were there to help them in any capacity that they needed. Even after the grant was over, we learned as much from Anna and her community, hopefully, as they learned from us. And it was really a wonderful experience.
Thank you, Mary. I heard a few things, and I'm hoping that the attendees really write this down. From Mary's experience, I heard that there was this desire and interest to share resources with the community that needed them. I heard that it was not your intention to say, this is what we have, this is how we're going to do it. It was these are what we have. How can we help you? How can you use this? How can we change it so that it's meaningful to your community? And then I heard something else, Mary, that it's very rare to hear. You are seeking true partnership, true collaboration with the community. And even if there is no money involved, which is just amazing, you still want to show up and be present and help. That is what it is to be in community. That's taking care of one another. And that's showing to me and to others, I hope, that no matter what backgrounds we come from, that we recognize that we're in community together. We're all in this together. And to have a stronger community, to have a stronger nation, really, this is the key, to see each other and be there for each other.
Absolutely.
Thank you. Thank you, Mary. I'm going to now ask Sarah to share with us, for those who might not know, what is the CDC's Hear Her campaign is, and how this campaign has focused on American Indian, Alaska Native women.
Yeah, absolutely. Thank you, Janelle. This is I think it kind of building on Mary's response. We know that too many women die in the United States from pregnancy-related complications, and that American Indian and Alaska Native women are disproportionately affected. So the Hear Her campaign is an effort that supplements the other efforts that are in place at CDC to try to prevent those deaths. So the Hear Her campaign focuses on the urgent maternal warning signs, which are signs that could indicate a life-threatening situation. And so by raising awareness of those urgent maternal warning signs, we're trying to make sure that people who are pregnant and postpartum, their support people, and all of the people that surround the women in that care know that these are times when that woman really needs to get care immediately, and that recognizing those signs, hearing that person sharing those concerns can and getting them the care they need, that could help to save lives. And so similar to what Mary shared, we knew when we launched the campaign that we needed to have resources for American Indian and Alaska Native people. So we took a step back to really do some listening, to reach out to our American Indian Alaska Native colleagues and to people in the community to say, hey, here are the resources that we have and the information that we have. Is this information helpful? What do we need to do to make this culturally appropriate? And over the course of more than a year, we did a ton of listening, right? The core of everything is listening to really make sure that what we do is informed, and then engaged American Indian and Alaska Native photographers and artists and other people in producing a suite of materials that would be culturally appropriate that we could share back with the community. And so this past November, we released this suite of resources. And the center of those resources is the stories of 5 incredible American Indian women who were brave enough to share their experiences with pregnancy-related complications. And that is what drives this campaign, is elevating those voices and making sure that people are aware of what is happening, what these experiences are, and the fact that that these concerns are real, and that we need to take action and make sure that these women are heard and get the care that they need. And as we move forward in implementing this campaign, our goal is to make sure that we are sharing these resources in the best way possible for communities to be able to take and use in the way that works best for them. So that's something that we hope that we'll be able to continue to do in a meaningful way by directly engaging tribes, tribally serving organizations, and urban Indian organizations to use these resources in the best way locally.
Thank you for that, Sarah. I hear from what you're sharing that women have not been heard. And this very simple campaign, Hear Her campaign, while originally was targeted towards providers to really listen to patients, and there's a need for that, that representation also matters. And can you speak just a little bit about how representation matters for specific groups of women? And then How has the Hear Her campaign changed outcomes and experiences thus far?
Yes, absolutely. So we talk about the disparities in health outcomes, right? Across the board, we see disparities in health outcomes and with chronic disease, with maternal health, and in all these places. And those disparities, they build on each other, and there are interrelations there. And so when we talk about solutions, about how we actually start to address the disparities and to bridge the gaps in outcomes, what we need to do is to make sure that we are hearing from those people, right? And so it's incredible to see, the people at the table today, and to continue to see diversity and representation at the tables where these conversations are happening. And that is what we need to continue to see, is that increased representation. And so to take it a step back, I think, that representation is so important on every level, right? So when we talk about the stories in the Hear Her campaign, it is so important that we're sharing the stories of African-American women, of Black women, of American Indian and Alaska Native women, because we know that they are experiencing disparities, and they're experiencing more of these, the adverse maternal health outcomes. But then on the community level, when we look at solutions at the community level, maternal mortality review committees and these other efforts that are in place to make improvements, we're making sure that there is diversity at the table, that these voices are part of the solutions for themselves and for their communities, because that's the only way that it's going to be impactful, right? And so I think that representation and diversity is important for that positive change. And then one more element of it too, because I think all of that is really thinking of it from the public health level, is just how important it is for people to see themselves in these stories and these resources. And I'll say, when we first released these, the stories of the American Indian women who shared their experiences, I received so much feedback from American Indian colleagues and partners who just were thrilled to see themselves in these public health resources in an honest, genuine, beautiful way, not in any kind of stereotype or stock image, but just a real experience and their culture reflected in these resources. And it helps others to share their experience and to share their needs in a genuine way that can then, it just builds on being able to have better representation across the board.
Thank you. I hear that representation helps break down stigma as well about maternal mental health. And that is something that in conversations with each of you, I've heard that message as well. As a final question to you, Sarah, just what has the CDC seen immediately that has changed the outcomes or patients' experiences or providers' biases or awareness from the CDC's Hear Her campaign?
Thank you. So I think, when we think about the Hear Her campaign, we know that we're reaching the people that we want to, right? When we look at efforts from CDC, we want to just get these resources out across the nation. And since we launched the campaign, we've actually had, I'm just checking the numbers as I speak, we've had 1.5 million unique visitors that have come to the Hear Her campaign webpage, and over 250 million impressions of the Hear Her messages and content through digital and social media. And so those are some of those big picture numbers of the reach of these resources. But then we've also done a survey to understand are the resources having the desired impact? So we did an internet panel survey that was conducted in the first 7 months of the campaign. And one of the big takeaways was it showed that people who were aware of the Hear Her campaign messages were more likely to seek information or to talk to their healthcare provider. So the resources that we have are helping people to feel comfortable sharing their concerns and getting the care that they need. But, as we keep saying, that beyond the data, the stories, the personal experience is the most important. And so I'll just share one OB patient had shared that the campaign had opened her eyes to more information that she could use to talk to people around her, and that she felt that they had to listen to her concerns and come to her aid if she needed help. And so that has been consistent, that feedback that these resources are validating women's experiences, reminding everyone that women know their bodies best, and that we really need to listen and help them get the care they need and be respectful of their needs in getting them that care. Thank you.
Thank you, Sarah. Thank you. Mary, who must also be included in this urgent maternal mental health matter? You know, we think of all the partners, like who else must be involved, must be all in to making this happen?
So I think everyone needs to be involved. People in the community need to be involved, because sometimes it's a friend, a sister, a colleague that notices that a mom is in crisis. We need healthcare providers, every healthcare provider who comes in contact with a mom to be included. We need policymakers. We need our government, our legislators involved. We need the people who fund all of our projects to be involved. When you think about it microscopically, it's almost everyone that we need to be involved in the conversation. We know that maternal mental health disorders cross socioeconomic lines, education lines, age lines, race. We're all affected in some way, shape, or form, whether it's our own lived experience or someone we know. And really, we can probably all name someone we know with lived experience. So everyone needs to be involved in the conversation, but especially the folks from those marginalized populations, because their healthcare providers are the best people to help their communities. They are the first resource sometimes that these moms have. And with the stigma that's involved, we want to make sure that these folks from these marginalized populations are always included in the conversation.
Thank you, Mary. That's wonderful. Everyone's involved. Everyone must be involved. It is a matter for everyone. It affects everyone. Anna, for my last question, I'd just like to ask, can you share your perspective on, thinking about the CDC's Hear Her campaign or any kind of community involvement and actions that can be taken? What can be done or should be done to improve maternal mental health?
I think it is very important, again, to bring community back into the birth experience, postpartum experience, especially. Being on the task force for Suffolk County, it really opened my eyes to this community called a casserole community, right? And you're dropping off a casserole to check in on a person to see how they are and how they're doing. And I think it's really important to remember that we need to hold the moms. We need to hold the birthing people. Everyone is so excited and in an uproar about this new life that we have, and that's great. But what about the moms, and what about the birthing people? Are you checking in with them? Are you asking them how they're feeling? Are you offering a meal to them? Are you asking them if they want a restaurant food delivery to their house? Are you helping them take care of maybe the other 2 children they have in the household? And I think it's very important that in order to improve outcomes, we really need to take a look at how we are treating our relatives and building those villages and building those connections. I think it's so important because, again, if we look back on our ancestral teachings and our history and our stories, we built a village and everyone had a part. And I put so much emphasis on that because in the past couple of years, I've really learned that community is so important, and it's imperative to ensuring that that everyone has not only a place, but that everyone is contributing to the health and wellness of the people.
Thank you, Anna. I want to thank you all for participating on this panel, because everything that you have shared, you have all of a very powerful message. I hear that community is needed and to be brought back in to the birthing space and the experience. Mary's experiences have shared that maternal mental health issues affect all people, all spectrums of life, all economics, all ages, all experiences, and that there are ways that we can bring community and resources to others, to our neighbors, and share what we have and fold them into this work. I heard from Sarah from the CDC that representation matters, that for such a long time, Black, Indigenous women, marginalized women of color have not been listened to. And it does matter to bring their voices and their stories to the forefront. And it's more than just collecting data, it's actually sharing lived experience so that there are teachings that can be imparted. Everyone who has attended today, you have all been anointed with all this information. And I challenge you to think about what you can do personally and what your organization can do as a whole to advance a new vision, a new thought on how to care for women, infants, for our community. Because what we have done in our nation has not worked. When we work separately, when we separate the mind, the body, the woman's body from community, the woman's body from history, the woman's body from family, and we just focus on the illness, that does not help. Much more holistic view of that person in her life is needed. So I challenge you all to think about how we can do that, how we can be in community with each other. Thank you for your time.
Thank you so much for moderating an incredibly rich discussion, Dr. Palacios. And thank you, Anna, Mary, and Sarah, all for your words of wisdom. Truly remarkable. I haven't had goosebumps so many times as I have in this session, and I think all of our forums combined. So just beautiful words and really important words. And I wanted to just repeat some things that we heard earlier. We heard loud and clear that it's time to share resources, to offer help and partnership. And that's really what it means to be in community. And then I have to repeat the casserole community comment. So beautiful. I haven't heard that term before, but of course it's what women have been doing for one another for so long, and we need to do more of it.